Helminthiasis is a disease in which a part of the body is infested with one or more intestinal parasitic worms, such as roundworms, tapeworms, or flukes. The worms usually infest the intestine, but sometimes they may invade other organs.
Helminth can be divided into two major classes. They are roundworm or nematode and flatworm, which consists of chestod and trematode. Nematodes or roundworms and chestods or tapeworms usually colonize inside the GI tract, whereas trematodes or flukes usually colonize outside the GI tract.
Life cycle of helminth. The life cycle of helminth is continuous. It begins with the excretion of feces by an infected human body. Inside the feces, there are larvae of worms which can form adult male and adult female. The replication of the worms occurs outside the body, where adult female and adult male mate up and produce eggs. When the eggs hatch, worms are produced and therefore a colony of worms is formed. This colony of worms can enter the body by two different ways. They can either enter the body through the skin or through the mouth. Some of the worms can penetrate into the skin, whereas some of the worms can contaminate the food which will be eaten by humans. In either way, the worm will eventually migrate to the intestine. Inside the intestine, they will mate, produce eggs, grow into larvae, and the whole process begins again.
For a person having helminthiasis, he or she may have the following signs and symptoms: bloody diarrhea, dehydration, fever, weight loss, headache, chest pain, and fatigue.
Pharmacokinetic of benzimidazole.
After a person is infected by the worms, benzimidazole, which is one of the antihelminthic agents, is given to the patient. Benzimidazole is normally administered orally. This drug can be divided into two categories, which are good absorption and poor absorption. Examples of good absorbed benzimidazole are thiabendazole and albendazole. These drug molecules have high rate of absorption into the small intestine. They are then diffused into the blood and transported by the blood to the target tissues of the body. After that, the drug molecules are transported to the kidney to be processed and excreted out of the body in urine. On the other hand, the example of poorly absorbed benzimidazole is mebendazole. Besides thiabendazole and albendazole, mebendazole is also absorbed into the small intestine and transported to the target tissues by the blood. However, this drug is very poorly absorbed into the small intestine. As a result, there is a high excretion of this drug through bowel as feces. Mechanism of action of benzimidazole. Benzimidazole is one of the most commonly used antihelminthic agents. Benzimidazole disrupts the formation of microtubules inside the worm cells. Microtubules are made up of alpha and beta tubulins which align themselves alternatively. Polymerization of alpha and beta tubulins forms microtubules which function to transport glucose molecules into the cell by endocytosis. When the benzimidazole molecules enter the cell, the drug molecules will bind to the beta-tubulins. This prevents the alpha-tubulins from binding to the beta-tubulins. As a result, the polymerization of helminth tubulins cannot occur. This means that no microtubule can be formed inside the worm cells. Without the presence of microtubules, glucose molecules cannot be transported into the cells by endocytosis. This will lead to the decrease in the concentration of glucose until a critical level. As glucose supply is depleted, no ATP is being generated, and without enough energy, helminth cannot sustain. Finally, they will die.
What are the adverse effects of benzimidazole? The general effects of benzimidazole are abdominal pain, diarrhea, dizziness, headache, insomnia, loss of appetite, hypersensitivity, and vomiting. Now, let us look at the specific effects. For albendazole, the side effect is Stevens-Johnson syndrome. The side effects for mebendazole are alopecia, anemia, and hepatitis. For thiabendazole, the side effects are enuresis, hematuria, and conjunctival infection.